All right, so my name is Lovepreet.
My name's Carter.
My name's Matt.
My name's Frey.
And my name is Yvonne.
All right, so we're going to be presenting ZenSeal. So I'm going to go over the major uses and properties of ZenSeal. It was released on November 10th, 2023 by Kerr Dental, so it's still a relatively new product. Its primary use is in endodontics, since it serves as a bioceramic sealer and it's designed for root canal obturation. So in other words, it's used to fill and seal the spaces within the root canal after it's been cleaned to prevent further bacterial infections. ZenSeal adheres tightly to dentin, and it's designed to work with wait, could you go back one slide? Is designed to work with gutta percha, which is a widely used thermoplastic material used as a permanent filling in root canals. It consists of tricalcium silicate, dicalcium silicate, calcium phosphate, and a radio opacity agent embedded in a hydrophilic matrix. This combination provides both high compatibility and excellent radiographic visibility, so it makes it easier for dentists to verify the quality of the root canal filling. Another important property is the high flowability of ZenSeal at 23.5 millimeters, which means that the material can flow into even like the smallest areas within the canal. Also, the property of zero shrinkage ensures that once ZenSeal sets, it maintains its volume and doesn't pull away from the canal walls, which prevents potential gaps or spaces where bacteria could enter.
So yeah, ZenSeal's calcium silicate-based sealer offers some new and improved features with both enhanced adherence and flowability. The sealer binds dentin to the gutta percha extremely well and tight, and like mentioned before, with zero shrinkage is observed. This sealer has shown high success in both simple and advanced endodontic root canal cases. This assurance and quality gives increased confidence to the clinician during root canal procedures. This is also a highly patient-friendly option with enhanced biocompatibility and very low, if any, reported complications from patients following treatment. This disposable syringe delivery system greatly reduces waste and messes during procedures by well over 60%. This is an efficient delivery system that's also cost effective relative to other brands, as it conserves far more sealer. And as mentioned before, the sealer is hydrophilic. This negates a lot of stress of having to rid the canal of any residual moisture before the clinician starts filling. The sealer comes pre-mixed, saving both the patient and the clinician's time during these root canals. So overall, these new and improved features will dramatically reduce complications in root canals, as well as eliminate extra procedural steps that could otherwise result in extra time and money from the clinician and the patient. These highly effective improvements make ZenSeal a highly viable option for any modern day doctors.
For ZenSeal, as discussed previously, is known to be a filling immediately placed in the root canal after removal of the infected pulp. And the only times when it's proper to use it is if the pulp is, like I said before, infected or damaged, is removed from the tooth, or same reasoning, but with a medicine, an intracanal dressing, which is placed to get rid of bacteria and prevent leakage of the filling placed. One important to note to take for ZenSeal is that it can only be used on permanent dentition, not primary. And a few questions to ask before proceeding to use the materials are if the patient has a history of hypersensitivity to it, such as getting a rash or dermatitis, if they're allergic to any of the compositional components, if the patient is pregnant or lactating, and if there's any discoloration or leakages seen on the product. If all of the answers are no, then you can proceed to use it. Instructions for the usage, it should be placed with isolation of the tooth, such as like a rubber dam, because it can cause unfavorable reactions if it comes in contact with the skin or tongue. Following the preparation of the root canal and cleaning of the now dry root canal, the working length of the root canal is measured and the gutta percha master point is chosen. And I wanted to put an emphasis on dry because if it is wet, it can affect the curing time. And the average curing time is usually 5 hours, 30 minutes. But if it's well prepared and dried, then it will be longer for stronger curing. So once that's done, a tip can be placed on the syringe for the ZenSeal, and the material is slowly placed into the canal. And following that, you should make sure there aren't any bubbles or if it's filled extra. If it is, clean the area to the right point of the root canal. And following that, you place the gutta percha and once again remove any excess ZenSeal. And that is the main important factors in the usage.
I'd like to take a moment to compare our chosen product to another MTA mimicking bioceramic. These dental materials have an inorganic calcium silicate matrix, like my colleague said before. This lets us know that ZenSeal has no cytotoxic materials like methacrylate resins, epoxy resins, silicone, or eugenol. The current industry standard of sealers of this class is EndoSequence from Brasseler Dental, which, much like our product, presents with great clinical properties. Both products are highly radio opaque, which allows the clinician to see the sealer radiographically at an extension of the gutta percha. And this helps the clinician ensure the closure of tubules or accessory canals. Neither product shrinks after curing, which prevents that pulling back, and both bolster a high pH due to their calcium content, which prevents recurrent infection and promotes periapical restoration of the alveolar bone. This is how it is able to be classified as a bioceramic. However, this is where ZenSeal takes over as the clear clinical winner in its class. It displays a higher flowability with a decreased viscosity that allows the sealer to go into those accessory canals and tubules much easier or much more easily than its competitor. The applicator tip is much more narrow and malleable than the EndoSequence tip and comes out of the box pre-bent. This means the clinician does not need to put in their own bend, which could kink the tip or cause any type of error, like the tip becoming more unstable, falling off. And as previously mentioned, this gives a incredible ease of access and control over the amount of material usage per application. These benefits, oh, sorry, I have one more slide. These benefits far outweigh the $12 increase in price when comparing the 2-gram syringes, because ZenSeal is able to complete twice the amount of cases as its leading competitor.
So to Carter's point, so would we recommend ZenSeal? Yes, we would recommend ZenSeal for cases that do not require an extended working time, because ZenSeal does cure faster than known competitors, specifically the one that we talked about, EndoSequence BC, or any cases that contain highly intricate anatomy. ZenSeal offers great biocompatibility, dimensional stability, adherence to dentin, reduced waste in its packaging, and a fast setting time. However, if the cases are more complex and need a slower setting time to give doctors time to adjust it in the tubules when they're sealing, then our competitor EndoSequence BC Sealer may be a better choice for what they are looking for in a root canal sealer. And these are our references right here. Thank you.